4 dangerous vitamins seniors should never take and what to use instead. They told you vitamins are harmless. Just take a multivitamin, they said. But what if some of those pills are silently harming your brain, bones, and even your heart, especially after age 60? Seniors beware. Not all supplements are safe. In fact, 4 common vitamins could be doing you more harm than good. As we age, it becomes more important than ever to nourish our bodies properly. Our bones weaken, muscles shrink, and our immune systems aren't what they used to be. So it's natural to reach for vitamins to fill the gaps. But here's a fact most don't realize. Some of the most popular supplements may actually be dangerous for seniors. Oversupplementation, wrong combinations, and synthetic forms of nutrients can lead to serious health risks like kidney stones, heart problems, cognitive decline, and even bone fractures. This video uncovers 4 vitamins seniors should think twice about taking, especially without a doctor's supervision. You'll also learn what safer alternatives or food-based sources can help you stay healthy and strong without putting your body at risk. But first, tell us in the comments, how old are you right now? Also, don't forget to like and subscribe for more age-defying health tips. And please stay with us to the end to hear about the vitamins that seniors should be taking according to American Journal of Clinical Nutrition. Now let's dive in. 4 dangerous vitamins seniors should never take. Number 1. Vitamin A, a risk to your bones and liver. Vitamin A supports vision, immune function, and skin health. It's found in 2 forms: preformed vitamin A, retinol, and provitamin A, beta-carotene. The former is found in animal products and supplements, while the latter comes from plant foods. Why it's dangerous for seniors? Preformed vitamin A is fat-soluble, which means it builds up in your body over time. Seniors are especially vulnerable to this buildup because liver function declines with age, making it harder to filter excess nutrients. Too much vitamin A can increase risk of bone fractures, lead to liver damage, cause dizziness, nausea, and blurred vision, interfere with vitamin D absorption. A major study in the New England Journal of Medicine found that older adults with high vitamin A intake had nearly twice the risk of hip fractures compared to those with lower levels. What to do instead? Avoid supplements with retinol palmitate or retinol acetate. Get your vitamin A from beta-carotene-rich foods like carrots, sweet potatoes, and leafy greens. Your body only converts what it needs. If supplementation is needed, talk to your doctor about low-dose multivitamins that keep vitamin A under 2,000 IU per day. Number 2. Vitamin E. Heart risks in disguise. Vitamin E is often marketed as an antioxidant that helps prevent aging and supports heart and immune health. Why it's dangerous for seniors? While some vitamin E is essential, high doses, especially from synthetic supplements, have been linked to serious health issues in older adults. Research from the Journal of the American Medical Association showed that vitamin E supplementation in high doses, over 400 IU day, was associated with an increased risk of death, higher incidence of prostate cancer in men, possible heart failure in people with existing conditions. Vitamin E can also thin the blood, increasing the risk of internal bleeding, especially if you're taking medications like warfarin or aspirin. What to do instead? Skip high-dose vitamin E supplements unless prescribed. Eat foods naturally rich in vitamin E, like sunflower seeds, almonds, and spinach. If supplementation is required, keep it under 200 IUs per day and choose the natural form D-alpha tocopherol over the synthetic version, DL-alpha tocopherol. Number 3. Vitamin B6, nerve damage risk. Vitamin B6 is essential for brain development, immune function, and metabolism. It's often found in energy supplements and multivitamins. Why it's dangerous for seniors? While vitamin B6 is crucial, excessive amounts, especially over long periods, can cause nerve toxicity. Older adults taking more than 100 milligrams per day have reported painful nerve damage, neuropathy, numbness and tingling in hands and feet, trouble walking or maintaining balance. The scary part? These symptoms may persist even after stopping the supplement. Your body only needs around 1.5 to 2 milligrams per day after age 50, yet many energy boosters contain up to 50 milligrams or more per dose. What to do instead? Read labels and avoid supplements with high B6 doses. Choose food sources like bananas, fortified cereals, poultry, and potatoes. If you're taking a B complex, make sure the B6 content is appropriate for your age. Ideally under 10 milligrams per day, unless directed by a doctor. Number 4. Vitamin C in high doses. Not as harmless as it seems. Vitamin C is often touted as a cure-all for immunity, colds, and skin aging. It's water-soluble, which means excess usually leaves the body through urine. Why it's dangerous for seniors. High doses of vitamin C, over 1,000 milligrams a day, can cause kidney stones, especially in older men. Digestive distress, bloating, diarrhea, increased absorption of iron, which can be dangerous for people with hemochromatosis. The recommended daily intake for adults over 60 is around 75 to 90 milligrams per day, yet many over-the-counter supplements offer 1,000 milligrams or more per tablet. A large study in JAMA Internal Medicine showed that men who took excessive vitamin C had a 41% higher risk of kidney stones. What to do instead? Stick to lower doses, no more than 250 milligrams per day unless prescribed. Get your C from real food: oranges, strawberries, bell peppers, and broccoli. Consider a buffered or food-based vitamin C if you're sensitive to acidity. What should seniors do instead? The key is not to avoid all vitamins, but to take the right kinds at the right doses from trusted sources. 5 tips for safe supplementing after 60. 1. Test before you supplement. Ask your doctor for blood tests to identify real deficiencies. 2. Choose whole food-based supplements. These are gentler on aging bodies and easier to absorb. 3. Avoid megadoses. More is not better, especially with fat-soluble or synthetic vitamins. 4. Check drug interactions. Some supplements can interfere with prescriptions like blood thinners, diuretics, or heart medications. 5. Focus on food first. Whenever possible, get your nutrients from a well-balanced diet of whole, colorful foods. As we grow older, our nutritional needs change dramatically. Our bodies don't absorb or process nutrients the way they used to. We lose muscle more easily, bones become brittle, memory may fade, and energy can dip. It's no surprise that many seniors over 60 are missing out on essential vitamins, nutrients that not only help them feel better today, but can also prolong life, sharpen the mind, strengthen the body, and protect against disease. Let's explore 4 scientifically backed vitamins that every older adult should consider adding to their daily regimen. Backed by studies and recommended by geriatric experts, these vitamins can help seniors live not just longer, but better. 1. Vitamin D. The longevity and bone shield. Why it matters. Vitamin D, often called the sunshine vitamin, plays a critical role in bone health, immunity, and mood regulation. As people age, they naturally produce less vitamin D in the skin, even with sun exposure. Vitamin D deficiency has been linked to increased risk of fractures and osteoporosis, weakened immune system, cognitive decline and dementia, heart disease and high blood pressure, chronic fatigue and depression. The science. A 2020 study published in the American Journal of Clinical Nutrition found that seniors with higher vitamin D levels had a 30% lower risk of dying from all causes compared to those who were deficient. Another large study from Harvard showed that adequate vitamin D levels helped reduce the risk of falls, a leading cause of disability and death among seniors. Recommended daily dose? 600 to 800 IUs per day is the general recommendation, but many experts suggest 1,000 to 2,000 IUs per day for adults over 60, especially in northern climates or those who rarely go outdoors. Best sources: sunlight, 10 to 20 minutes per day on arms, legs without sunscreen. Fatty fish, salmon, sardines, egg yolks, fortified milk and cereal. Vitamin D3 supplements, cholecalciferol, more effective than D2 for seniors too. Vitamin B12, the brain and nerve protector. Why it matters. Vitamin B12 is essential for producing red blood cells, supporting brain function, and maintaining nerve health. But here's the catch. As we age, our stomachs produce less acid, which is necessary to absorb B12 from food. B12 deficiency is common in seniors and can lead to fatigue, memory loss, and cognitive impairment, tingling or numbness in the hands and feet, balance problems, mood disorders like depression. Left untreated, B12 deficiency can mimic dementia, and in some cases, the damage is irreversible. The science. A 2021 review in the Journal of Alzheimer's Disease confirmed that older adults with low B12 levels experienced faster cognitive decline and had a higher risk of developing Alzheimer's and other forms of dementia. Recommended daily dose. The RDA is 2.4 milligrams per day, but many seniors benefit from higher doses in supplement form, especially 500 to 1,000 millisecond day if deficiency is present. Because absorption declines with age, sublingual, under-the-tongue tablets or B12 injections may be more effective. Best sources: animal proteins, beef, poultry, fish, dairy products and eggs, fortified cereals, B12 supplements, cyanocobalamin or methylcobalamin. 3. Magnesium, the muscle, heart, and sleep enhancer. Why it matters. Magnesium is involved in over 300 biochemical reactions in the body. It supports muscle function, nerve transmission, blood sugar control, blood pressure regulation, and quality sleep, something many seniors struggle with. As we age, magnesium absorption decreases and urinary excretion increases. Certain medications, like diuretics and acid blockers, further drain magnesium levels. Symptoms of deficiency include muscle cramps and weakness, fatigue, irregular heartbeat, insomnia or restless sleep, anxiety or mood swings. The science. A 2022 study in Nutrients found that magnesium supplementation improved sleep quality and cognitive function in seniors. Other research links higher magnesium levels to lower risk of stroke, type 2 diabetes, and heart disease. Recommended daily dose. Men over 60, 420 mg day. Women over 60, 320 mg day. Note: taking too much magnesium at once can cause loose stools. Spread your dose across the day or opt for a gentle form like magnesium glycinate or citrate. Best sources: leafy greens, spinach, chard, nuts and seeds, pumpkin seeds, almonds, whole grains, legumes, magnesium supplements, especially if dietary intake is low. 4. Omega-3 fatty acids, the anti-inflammatory lifesaver. Why it matters. Omega-3 fatty acids, especially EPA and DHA, are essential for heart health, brain health, joint function, and inflammation control. They're found mainly in fatty fish and are often lacking in the modern diet. For seniors, omega-3s have been shown to reduce risk of heart disease and stroke, lower triglycerides and blood pressure, protect against age-related macular degeneration, improve cognitive function and memory, ease joint pain and stiffness. The science. A landmark 2019 study published in the Journal of Clinical Lipidology found that older adults who took omega-3 supplements had a significantly reduced risk of fatal heart attacks. Another study in neurology showed improved memory and verbal fluency in older adults who increased their omega-3 intake. Recommended daily dose: at least 500 to 1,000 milligrams of combined EPA plus DHA per day for heart and brain health. Higher doses, 2,000 to 3,000 milligrams per day, may be recommended under medical supervision for those with heart conditions. Best sources: fatty fish, salmon, sardines, mackerel. Fish oil supplements: choose molecularly distilled for purity. Algal oil, plant-based source of DHA for vegetarians. A quick note on multivitamins. Multivitamins can be helpful, but they're not created equal. Many off-the-shelf formulas contain synthetic, poorly absorbed ingredients or doses that are too high for seniors. If you opt for a multivitamin, look for age-specific formulas, e.g. 60+ or senior. Low levels of vitamin A and iron, which can be harmful in high amounts for older adults. Methylated B vitamins for better absorption. Trusted brands with third-party testing. How to add these vitamins to your routine. Safely 1. Get tested. Before taking any new vitamin, get your blood levels checked, especially for vitamin D, B12, and magnesium. 2. Start with food. Supplements are helpful, but real food provides enzymes, fiber, and cofactors that pills can't. 3. Go low and slow. Start with lower doses and work up as needed, especially for magnesium and omega-3s. 4. Monitor interactions. Talk to your doctor if you're taking prescription drugs. Some nutrients can interfere or enhance medication effects. 5. Stick with it. The benefits of proper vitamin supplementation often take weeks or months to fully appear. Don't just add years, add quality. Aging is inevitable, but decline is not. By giving your body the right nutrients, especially vitamin D, vitamin B12, magnesium, and omega-3s, you can build stronger bones, sharper memory, better immunity, and a more vibrant quality of life. Think of these vitamins as small investments with big returns, helping you walk more confidently, think more clearly, and live more fully for years to come. Be informed, not overwhelmed. The world of vitamins and supplements can be confusing, but it's vital for seniors to understand that natural doesn't always mean safe. With age comes changes in how your body processes nutrients, medications, and toxins. What worked in your 40s may now backfire in your 70s. If you're over 60, make every supplement count. Avoid the 4 dangerous vitamins we covered: vitamin A, vitamin E, high-dose B6, and high-dose vitamin C, and focus instead on a food-first, doctor-guided approach to better health. Because the right nutrition won't just add years to your life, it will add life to your years. Don't just live longer, live stronger. Start today. Which of these vitamins are you taking? Let us know in the comments, and don't forget to like and subscribe for more health tips. Have a great day, and stay healthy.